Hi, everyone. Welcome back to another episode of Making a Difference in Mental Health. I'm Danielle.
I'm Wendy.
Wendy, what are we wearing?
Girl, it is football weekend. It is the NFC Conference Championship game. It is our birds and your commander.
Listen, I am in solidarity with the DMV. This is a shout out to my brother-in-law. Honestly, I like both teams, but for different reasons that I'll discuss at another time on a different podcast. But it is so exciting. It's an exciting time for this particular area. And so, hey, you know, why not rock a Commander's hat and you got your Birds jersey? We always talk about the Birds, Sunday. Always. So we're excited to be able to just kind of bring a little bit of sports and fun and, you know, a little bit of competition
to the
podcast. But so we are so excited.
Best team win.
Yes.
Go Birds.
Come on, Commanders.
What are you going to do? Yeah. Anyway, so today we're very, very excited. We have two lovely guests so that we can start a topic conversation on neurodiversity. Yes. I feel like this is like a kind of new buzzword that people aren't really familiar with. Well, what is it? What does it mean? And so we're going to dig into it. So today I'd like to welcome Amelia Dahl. She is an intern here at Advanced Behavioral Health. And we're welcoming back our guest that we've had last season, Madison Grier, my baby. And she's going to talk about her experience with neurodiversity.
Welcome.
Welcome, ladies.
Thank you. Pleasure to be here.
Absolutely. So let's get into just what that word means, neurodiversity.
Yeah, I'll go ahead and interject first here. When I really think of neurodiversity and that new word, you know, it's a inclusive way just to kind of to describe how all our brains are different, right? That there's many different ways. Even they say identical twins do not have the same brain. That there's different things going on. So things to consider. And in the neurodiversity category includes a lot of things. And I know we're here a few different perspectives today, but that's really the place I think it comes from.
Right. So I think it's like pushing back on what's air quotes normal or a standard that, you know, we are used to kind of living by and saying, well, exactly what you said, Amelia, people's brains are different. People's body chemistry, biochemistry is different. And the differences don't mean that you're abnormal.
Right. Madison, what are your thoughts on neurodiversity? What is it?
It's just a unique way of how people's brains function and develop. Simple as that.
I think we also have had to educate ourselves on the topic of neurodiversity. And I think as clinicians, it's like we know the different components, but to have it in umbrella form, so to speak, and then, you know, breaking it down into different subtopics, subcategories, or functionalities, but still all, you know, we are all unique. And like you said, not one way of thinking or one way of doing things. There's so many different ways that make up a person that is so totally unique, but still, you know, we're able to function in a certain way. Yeah.
And that brings like really cool kinds of differences.
Yeah.
So absolutely cool. So does this category, because again, you know, our podcast, we like to speak to parents a lot. And so if we're speaking to parents, we're clinicians, so we kind of know. But if I'm a parent and I just happen to tune in, does this mean, what does it mean if I have a kid that has a disability? Is this something that falls under that category of neurodiversity?
Yeah, and I can speak a little bit because I fall into that category of being a parent who has a neurodivergent child. And kind of through just to give a little intro there, during the pandemic time, we had another factor of our youngest child was diagnosed on the autism spectrum disorder. He was about 3 at the time. So yeah, it's having a neurodivergent child, having those things would be considered a disability because you start working different ways. There's different services. And there's a lot. It's a very, very complex topic. And I think very sensitive for a lot of parents who have gone through that. And getting that news is definitely a big news to get, and then adjusting to that. And and going on from that. So it brings a lot of grief for some people. And as we explained, even, and of course, my experience is with autism spectrum disorder, ASD, and that is a huge spectrum, right?
Mm.
And so even for parents in that same category, all of our experiences in that spectrum are different based on where your child lands. So throughout the process, you know, there's different kids that need more support in different areas. It's a very, very overwhelming process as a parent to get the news and really you have, what can I do for my child? What tools do I have out there? What services do I have out there? And then kind of the added challenge, I think, of being the advocate for the child's and seeing that unfortunately there's still, society has different views on that. Society has a lot of miseducation. Really hoping that your child has everything they need and can thrive, because kids with ASD and neurodivergent they really can. They're capable of
Right.
so many things. So
Right. I think that's the biggest key you just said, is that they can. Yes, when you first get that news, it's very overwhelming in terms of services and how do I communicate with my kid and what do I do, et cetera, et cetera. But they can succeed. Tell me a little bit, Amelia, about Asperger's. That was a big term used a while ago. And now, what is that meaning when you're talking about neurodiversity or ASD?
yes, thanks for bringing that up, because as I mentioned just a minute ago, there is a lot of misinformation out there, and information that we definitely want to educate their parents on and society. So Asperger's has been used in the past to kind of explain. Now it's been lumped into the autism spectrum disorder, but kind of a different part of autism, but kind of wanted to, there's several reasons why we got rid of that name. The first is that it was named after Dr. Han Asperger's, who actually collaborated with the Nazis in World War II. As a clinician, he caused a lot of harm because he deemed children with disabilities as unworthy, ran experiments, and even killed children during this process. So that's that's definitely a name we don't want to use anymore. We don't want to associate with that anymore. So that's one reason. Another reason is we want to look kind of dismantling a hierarchy of the autism in general, right? We don't want some in this category, some are in this category, and people thinking one is better than the other. So instead of having a spectrum, right, is a much better way to put it. So definitely it's good to put that education out there. That's the term we don't want to use anymore. In 2013, it's been removed from the DSM-5, which we know as clinicians use for diagnoses, so no longer should be used.
That's a good tip.
Yes. And, you know, Amelia, I do want to thank you again for coming on, not only as a clinician and an advocate, but as a parent. You know, we do have families that watch or who are maybe lay people and might not understand or need psychoeducation when it comes to a lot of different mental health challenges or disorders, or even conditions. And the fact that you're providing education about not only just the categories within the neurodivergent spectrum or ASD, but letting us know, listen, even some names can be archaic, and we're moving forward. We're moving to push, you know, new information and new psychoeducation, and continuing to inform and educate to bring a higher level to parents. And then also, I like the fact that you do bring up the point that sometimes there might be a little bit of a mourning process for parents to understand that, okay, this is the diagnosis that my child has, but there are resources out there. There is education out there, because they are still able to do.
Yeah,
it might just look you can thrive. It just might look a little bit different. So thank you, Amelia. And Madison, what are your thoughts? What are your thoughts as well before we get into the next question, which I think you'll be able to tap into as well. But what are your thoughts before we move on?
So I do believe neurodiversity does come with developmental disabilities. I do have migraine, which I'll touch on a little bit later. I do have migraine probably since I was 5. I think what helped me develop and learn how to speak, right, just go up through my education was actually like learning my learning style, whether I was an auditory learner, vision learner, or hands-on. I think for me, hands-on is the best because I do get a lot of brain fog, especially if I'm trying to multitask or if the teacher is teaching like some certain type of way that I'm not comfortable with. I have to take my time and review information on my own to make sure I still can succeed and I'm able to learn what I need to learn. So it's really just developmental disabilities is really just understanding how you function and what you need to do in order to succeed and be successful.
Mhm. I love the way that you bring up there are different ways to learn auditory, visual, and even kinetic. And I think that's another thing we can talk about this another time too, that maybe teachers could also be informed about where, you know, there might be a kid or a student, like you just said, Madison, sometimes you might have to take time out. It's not that you don't know the information, it's just that you might either retain, obtain, or you're able to then give back in a completely and totally different way. You're still able to thrive. It just looks different.
Right.
And so
just imagine how hard that is
Yeah.
for, you know, Madison's an adult and has been through, you know, college, you know, managing all this and actually thriving and succeeding. But just imagine as you,
Mhm.
Amelia, your child in, you know, primary school, trying to figure that out and then trying to relay that information to a
Mhm.
teacher. So I
Mhm.
think this would be very helpful for teachers to remember, you know, kids aren't trying to be disruptive. They're
Yeah.
trying to be
Yeah.
quote unquote bad, but if you're not tapped into learning style
Mhm.
and, you know, maybe they're having, you know, issues with how to communicate
Mhm.
and receive information, then it does look like that. So
Yeah.
this is a great
Absolutely.
information for teachers.
Mhm. And you know, Madison, you kind of tapped into a different section of neurodivergence when we talk about the cognitive deficits, and you were talking about migraines. And I do know that sometimes there are other conditions that may go into some challenges with being able to focus. I think you said something about brain fog, or you said something about, you know, sometimes having a little bit of challenges because of your condition with the migraines. Can you talk about that as well?
Yeah, so I'll just define migraine. So migraine is an actual neurological disorder that comes with light sensitivity, food sensitivity, smell sensitivity, brain fog, or just having moments where you can't focus on one thing. And a lot of times, especially in women and females, because it's most common in women and females, it's diagnosed as a severe headache. It's an
Mhm.
actual legal disability. So that's kind of what I went through. I started having attacks, which is what you call a migraine. When you have a migraine, they're called attacks. I started having attacks when I was like 5 or 6. And every time I would go see my pediatrician, they'd be like, "Oh, you just have a severe headache." It's kind of some like hesitance to kind of diagnose me with migraine. And a lot of times you'll get a diagnosis and like, oh, change your lifestyle. You're stressed out. You're not eating the right things. And then that prolongs and actually worsens my condition. And that's why a lot of people now have trouble managing those issues. So to come along with that, with me having brain fog and having moments where I just need to take time and like do what I have to do to like regroup, that really came about in college. College with big lectures and specific classes you have to take, it's not easy to communicate with the professor when you're struggling. For example, I was a biology student at Temple University, and all my major introduction classes were 300 plus students. So I was
Mhm.
kind of like a statistic in a class. All they cared about is my test score, the bell curve, and what the department is going to say about if their program is doing well. So I had to find a way, whether it was retaking notes or just I personally getting through college. I have an iPad. I would draw out pictures of like if I'm learning about cells, DNA. I also have a feature where I can record lectures and listen back to see if I missed any information. Then I also had the trouble. Some lecturers didn't supply you with anything. No PowerPoint. You just went to class and you're expected to just listen. No
Mhm.
textbook, nothing like that. So it's just really just finding how you learn and how to manage having migraine. And I do appreciate the professors that did like send out like a pre-class like survey at the beginning of the semester and be like, is there anything you want me to know about to make your learning experience better for you? And I always say, oh, I do have migraine. There will be some times, well, I will not be attending class due to an episode because I won't be able to comprehend or fully take advantage of that 80 minutes or 50 minutes. So you might get an email from me. So yeah, it's really just communicating with the professor and then also just again, just knowing your body and when you need to stop and take a break to really digest everything.
Thank you even for your perspective as a college student. So we have a parent, we have a college student. I'm going to ask Wendy a question really quickly because she's also a parent of a child that has challenges with the cognitive deficits when it comes to a neurodivergent spectrum. How did it feel for you? You all said 5 years old.
5 or 6. So
How did it feel
yes,
for you?
you know, I wasn't educated. I just would go along with the doctors, you know, telling me that Madison just has a bad headache, but the recurrence was like abnormal. And I know migraines run in my family. So as she got older, and there's this one time I remember where it went for like 2 weeks or so, ER visits, everything, we could not calm her head. And then that's when I think it all just came to a head for me and just started understanding. I think that's when she went to a neurologist finally and not a pediatrician, and just understanding what is a migraine attack syndrome like. And then just working with Madison, I learned that this is a neurological disorder that is part of being neurodivergent because she has to make adaptations for herself in order to, you know, process information, learn, thrive, and be successful. And I just really didn't consider her having any type of disability until, you know, we did the presentation for our staff here at ABH on neurodiversity, and just realized that yeah, this is one of those things you call an invisible disability. Because if you look at Madison, she looks perfectly healthy. She looks fine. You don't know that she struggles with migraines to the extent that she does. And, you know, taking medication helps with it. But, you know, you just wouldn't know because people do expect when you have a disability, you physically show it.
Exactly.
I also wanted to add, so migraine is like a big like umbrella of different types of migraine. For example, I have episodic migraine. So I might have an episode that can last hours to days. Then I have days where I'm completely fine, and then I might get another episode. There are some people that have a severe type of migraine disorder called hemiplegic migraines that mimics a stroke. So they have Broca's aphasia, Wernicke's aphasia. They have to have like a migraine cap, and a migraine cap is essentially an ice pack that you wear around your head. Can't do any type of work and stuff like that. And then I also experience silent migraines, which I feel like is very important to talk about because I think a lot of people have headache as the defining symptom of a migraine attack, where you can have moments where I might have light sensitivity, smell sensitivity, but I have no pain. I might get the brain fog, might go through all 4 stages of a migraine attack, but will not have a headache.
Madison, I mean, you pretty much hit on our next question where you're describing your experience. Amelia, do you have any either personal experiences, or can you tell us a little bit more about the support that you've given for your kid, as Wendy says, whenever there was a challenge, or whether there was an episode or, you know, extended period of time with some symptoms from ASD?
Yeah, of course. Thank you. And going back to Madison stuff, it is a big key, I think, with a lot of those who fall under the neurodivergent umbrella of finding the tools she needs, right? I loved how she was talking about in school, she was finding ways that she could learn, either writing on her iPad or recording. And I think that's a big key, right? Is that there is echoing back, there is this capability, and these people can achieve a lot of things, but it's really finding the right tools for them to achieve that, and also making sure that society is giving them the tools, right, too. And that's where the advocacy comes in a lot. So back to my personal experience, for my child, as at a young age, we noticed he wasn't really speaking as he should. He did kind of in that early first year, and then it kind of disappeared. And he was more on the side. That was his biggest area of support, was his speech. And he does have what you would refer to as speech apraxia. So along with ASD, that he has kind of that cognitive where his brain doesn't know how to tell his mouth how to form the words.
Right.
So receptively, he can understand a lot, and communicating is kind of the area that we have our biggest challenge in. So we had him in speech therapy before he was even 2, has continued throughout this whole process. He also has a speaking device, which is like an iPad that can talk for him. That is another great tool that we can use, which is really, really helpful. So seeing that show, and this might be something he struggles with his whole life.
Right.
So we're prepared to do it. And that's another point with parents where some of the grief might come in about, what does this look like? And that, and anxiety even of how is how is he going to function in the world like he can? But again, providing those tools, they find a way, they are successful. So really with our child is just providing those services. We did early intervention. We were lucky that in his ways, even right now, we've seen so many improvements in him in other ways, in his social interactions and learning. He thrives in school. He's ahead of his grade level. He's doing really great. So it's really a big thing that getting the diagnosis, finding the tools that they need, finding the areas of support to really focus in. And there's really, you can see a lot of progress in a lot of space. And that's something that I see a lot of misjudgments too. You see it in media and stuff. And sometimes they think, well, on the spectrum, kids aren't capable of this, or sometimes this bad behavior is going to come out, and people aren't really aware that autistic kids are so capable of empathy and taking care of people and having social relationships. And that's something that we really want people to know and be aware of, to give them that space to really teach you what they can do. So that's kind of been my biggest passion over the last few years, is kind of be a support for other parents and let them know that the capable, and also letting my child know his strengths and giving him what he needs so he can be like any other child out there and have those same experiences.
Right. But what do you all think? I'm going to bring up something just a little bit controversial, but I think it's relevant to this conversation. So Elon Musk this week made some type of speech at the inaugural and did a hand gesture that many took as being like a Hitler gesture. And a lot of people are like just dismissing it and saying, oh, well, he's special, or he's on the spectrum, or blah, blah, blah. And, he didn't mean it. He just doesn't know better. What do you say to people who say that?
That one, as a parent again, and then in this predicament, those kind of get to me. So I got to take a breath. I got to realize, okay, but it's like I said, kind of echoing before, that children, adults on the spectrum are really capable of empathy and love and relationships. And I don't think using the diagnosis to make an excuse for any bad
behavior
should not be done. Completely inappropriate. And then it gives society the chance to do it as well.
Right.
They're going to go a thing, and then they're going to have expectations of other people. They're going to hear somebody who's on the spectrum and think, oh, well, they might not know how to act. They might not do this. And so it's really, really harmful wording, and shouldn't be used. And say if that was the case, say if someone on the spectrum has a hard time reading social cues, or gets overly excited and stims, as you might hear, which is, doing certain body movements that regulate them, then come out and say that. Do not connect it to your diagnosis, right? Connect it to, because I don't think any diagnosis, mental health diagnosis, should be weaponized in that way. So just say, oh, I was I didn't know what was going on with my body. There's different ways to say I can improve here and take that accountability, because that's another thing. People on the spectrum can also take accountability and also grow in their behaviors.
I think that's huge. 2 points that I like: taking the accountability, growing in your behavior. And it just speaks to why Danielle and I started this podcast. It's to not to, destigmatize when people want to demonize, mental health issues, or, as we're talking today, neurodiversity and what it means. So I think that was just an important point that I wanted to bring up for our audience, parents who are listening, kids who are, in this category with these disorders, that, you can thrive, you can be productive. It's not an excuse. You can be accountable, but, we as society need to get away from that.
Yeah. Also, again, providing the education and not justifying, as you said, Amelia, bad behavior as a condition or as a symptom of a diagnosis, and also educating yourself on the diagnosis,
right,
to know what is part of that particular behavior under the criterion of the DSM-5 and what is not. And I think that's really important, as we as professionals and clinicians and those who are advocates for those within the neurodivergent community, though we might be, here's a vocabulary, neurotypical, though we might be neurotypical, for those who are along the spectrum for whatever reason, whether it's genetic or whether it's acquired over time, that we just continue to educate and not make excuses for bad behavior.
Right. And neurotypical means, the standard that we're normal. And so for me, we just need to get away from that. Like, people learn and thrive and grow and prosper in many, many different ways, as long as we give them the support and the tools to do so.
I think, and that's our big thing here. Like, we're always trying to educate, just kind of leveling up when it comes to this area of mental health and the different topics that we talk about and discuss. And for everyone from the clinician who needs to kind of have a refresher, to the layperson who is just coming into knowing about, psychoeducation, something that they did not know or did not think they would need to invest in, because either their self, a child, or a family member who now needs this type of support. So, yeah. So, you know what? Before we get to the tips from both Madison and Amelia, Amelia, you did say something about media. I heard media. And so what I'd like to do today is, just for those who are wondering, well, is there anyone in the media, on the positive side, anyone in the media who is along this particular spectrum of neurodivergence, or is just a little bit not neurotypical in a sense, but
that you wouldn't know.
That you wouldn't even know. And that's the thing, you wouldn't know, but
we're going to tell.
I have just a few people.
We're going to share.
Even along the broad span of neurodivergence is ADHD. And so I have a list of actors, and it's interesting because we find that sometimes when you read in the research, those who are within this particular spectrum are quite creative. You find singers and artists, and I mean, even performer. You talked about sometimes it's easier for you to learn from your classes and courses by drawing, or sometimes it's through expression with your body. It might not always be your words, but we find that we have a whole list of actors here. We have Ryan Reynolds, we have Dan Aykroyd, we have even Jennifer Aniston. She's processed and through therapy, she said that she was diagnosed with dyslexia, and she never understood why her scripts would hop back and forth. Those letters would hop back and forth, and she was diagnosed in adulthood, which is interesting too, because sometimes we may go through life, and I'll say this, just, my family, they're from the country, they're from the South. So some things, they're just born with that, or they're special.
Right. And that's what we're trying to get away from.
And we, special in a way, but let's get some education about life. So sometimes there are diagnoses that happen in adulthood. A very interesting story about Cher, the performer Cher, is that she's diagnosed with dyslexia and dyscalculia. I hope I'm pronouncing that correctly, but what she said was during her school age years, elementary, middle, and high school, she had a really hard time reading. The letters and numbers would jump across the page. So she said she began to have, what is it, a photographic memory, listening and watching her teachers write on the board. And then also just having a memory of remembering exactly what was read to her or what was taught in class. And that was the way that she was able to make it through. Yeah. And it's interesting because then she becomes this artist, you know, like world known
artist.
And she's a writer and she's a singer and, you know, all of these things that you would seemingly be a deficit. She's thriving. It's just different. It's just a different way of learning. And we've already talked about Elon Musk and we've kind of went through that. And then the one last person that I'll say, who I really found to be brave back, I think it was, I don't remember which Olympics it was, maybe not this last one, but the previous one before. Simone Biles, when she began to talk about her mental health, she was, the ceremony had already gone in for the Olympics and she pulled herself out because of her experiences with anxiety and depression. And she's also diagnosed with ADHD.
And the twisties.
And the twisties. So what the athletic world might know as the twisties, we as the clinicians understand that could be anxiety, or depressed mood. And so I admire someone who is on a global stage to say, I have to put my mental health first. So just want to provide some.
Look what happened. She rocked it out last year.
Yeah, she came back. She came back.
So these are, you know, real life examples of how people, you know, work through these conditions to thrive and thrive to a very, you know, excellent level. Not a lot of us, you know, achieve. And so it's just hopeful. And you know, I just want to convey that to our audience, especially to parents, especially to kids who are going through it, especially to Madison, Amelia, that, you know, it's a good thing.
So with it being a good thing, Amelia and then Madison, do you happen to have any tips for anyone who is considering working with the neurodivergent population or those who have recently had either a family member or themselves diagnosed within the community?
So first with working with, and I think this is, you know, kind of advice that I've learned with working with different behavioral specialists with my son and speech therapists with my son is really you want to treat anyone on that neurodivergent differently, right? They all have different needs, different supports in different areas, and really learn from them what those tools they need are and kind of search that out with them. You can't completely ignore the neurodivergency and kind of just gloss over it because that's their lived experience. And through that lived experience, they've had things that have happened. And so I love, even though Madison brought up her teacher, of asking, what do you need? The accommodations, having that available. As a new parent, people need to know, people that maybe don't have it, have friends, you know, check in on those friends who have a newly diagnosed child or family member, because it could be really isolating. That's something I experienced. Not only was it COVID, but we had this new diagnosis. Your schedule gets booked up with behavior therapy and speech therapy and OT therapy when you have a child ASD perhaps, and you can't go to those play groups. You can't go to the mom functions and stuff. You're that support, you're that caretaker. Anyone, even if not a parent, if they're a caretaker, you have that big responsibility. So really as a parent, get the support you need. Really, it's a whole different game, but there's tools for you too as well. There's communities for you as well. There's support. So those are the biggest advices I would give.
Madison, what are your thoughts as a young adult? You know, coming through it all.
So as a young adult, I was in a relationship and then also went through college. I think the biggest thing is to like be patient and also still not underestimate us. I have times I don't want to talk to anybody. My brain is just too overstimulated with what the day brought to it. And sometimes I just need to be in the dark. Yes, sometimes I can get an attitude because in that moment in time, it's too much going on and I can be dismissive to people sometimes, but that's not me necessarily trying to be dismissive. It's just saying, hey, I need some time to regroup and figure out what I need to figure out. And then again, just figuring out what accommodations you do need and being open to communicating that to whoever you need to communicate with, whoever you're dealing in with life. I work 2 part-time jobs right now, and they both know I have migraine syndrome and know I might wake up that morning with an attack and might not be able to come in that morning, and they completely understand, and I can get scheduled a different day to come in. So it's just being open to that communication as well.
Yeah, I think just not being embarrassed. I mean, this is who you are, and you are very aware of what you need. And so I think that is what's being translated to young adults, kids, as they learn to navigate, to, advocate and not be ashamed and ask for what you need, because people do give it to you if you ask them. What do you think? I think they
No, I think that these tips are very insightful. I was touched with listening to Amelia talk about, check on those parents. Sometimes you don't often think of the parent because you're so focused on the child, and like you said, those speech therapy appointments and behavioral therapy appointments, and we have to remember missing out on play dates, but we also have to remember mom, dad, or caregiver is also going through as well. Yeah. So I appreciated that. And I also appreciate, I always honestly appreciate Madison's candid conversation. She's straight up, straight to the point. And listen, sometimes you just need to be straight up and straight to the point for someone to completely and truly understand and get it. Yeah. So, Madison, Amelia, we truly appreciate you today. This was a topic that honestly we were going to talk about last season, right? And I think this was the most appropriate time.
Absolutely,
yeah.
So I'm thrilled that we were able to do it and bring on 2 very knowledgeable people to keep us informed and keep our audience educated. So thank you to both of you.
Thank you so much.
Thank you.
Thank you.
So, Wendy, we're wrapping up.
Yeah, get ready for our football, girl.
Okay. I'm going to be taking this. It does. But thank you all again so much for joining us on this conversation. Absolutely. I'm Danielle.
I'm Wendy.
This is Making a Difference in Mental Health, where we're always striving to make a difference in mental health. We'll see you next time.